Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Children's Hospital to help you sort through what's going on with COVID-19 in our community and, of course, across the region. And we always want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. If it's busy, call back. All right, today, Governor Cuomo says the curve might be flattening a bit, and we could be hitting the apex. But he stresses, don't let your guard down. New York's COVID-19 positive cases still on the rise with almost 140,000 infected. NASA Executive Curran today says there are more hospital discharges than increases of those coming into the hospital, which she says could be a bit of a ray of hope. Now, Nassau is considered a hot spot right now. It has more than 15,000 cases. Suffolk Executive Steve Bellone telling residents their sacrifices are saving lives. There are upwards right now of 13,000 cases there. Now, the U.S. Surgeon General warned we could be facing a Pearl Harbor or 9/11 moment this week with unprecedented numbers of coronavirus deaths expected coast to coast. The death toll here in New York, 4,758. NASA's lost 381, and the COVID-19 virus has claimed more than 200 lives in Suffolk. Now, in an effort to stop the spread of the virus, the governor today announced that schools and non-essential businesses in New York will remain closed until April 29th. At the same time, the governor doubled down on the punishment for violating social distancing rules. He raised the maximum fine from $500 to $1,000, and he called on local governments to, quote, do their jobs. And the Board of Regents has canceled the high school June Regents exams in light of the pandemic, and President Trump also has given the green light to allow the use of the USNS Comfort to treat both New York and New Jersey COVID-19 patients. All right, let's get right to our discussion right now. Joining us tonight, Dr. Sharon Nachman, Chief of the Division of Pediatric Infectious Diseases at Stony Brook Children's Hospital. As always, thank you very much. First, thank you for everything you do and for all of you're doing right now, because you're all heroes, and I can't say that enough. And I know Long Islanders across the island are thinking that. So thank you.
Thank you.
Let's start by you. You guys are working so hard. What are you doing when you're not working?
So, like many of my friends in the hospital, we're all working crazy shifts and crazy hours, and everyone has something they're doing to decompress. Myself, I'm cooking. So my husband's home and he says, I better stop all this extra cooking because he's starting to gain weight.
Oh, well, that's probably happening to all of us right now, unfortunately. Let me ask you this question. I get this question a lot, and I've kind of heard differing opinions on the mask situation, on whether we should be wearing masks out in public, and more importantly, are scarves sufficient? I see a lot of people wearing scarves or other type of just kind of cloth headdresses.
So I think the masks made out of scarves and cloths remind us to keep away from other people and maintain that social distancing. How effective they are remains to be seen, but they're certainly more effective than wearing nothing in front of your nose and face. But I want to remind people that wearing the scarf around the chin, probably not so helpful. That if you're going to use something effective, it does have to cover both your mouth and your nose. And
then it's important probably to wash that when you get home too, right?
Like anything else you're touching, washing with soap and water really does work.
Okay. Let me ask you this as well. This happened over the weekend. There have been a couple of tigers that have tested positive in the Bronx Zoo for COVID-19. Does this change how we think about how we should be treating our animals as far as transfer goes?
So the answer is it's a totally uncharted territory. To date, we've never had a single report of any animal that's in our habitat, our dogs and cats in the house, our birds, etc., of catching COVID. So I think it is an unusual experience and event. It needs further investigation, but shouldn't stop us at this point from petting our dogs, taking them for walks, or having our cats or other pets in the house.
Okay. Let's go to the phone lines. Do we have Jim from Smithtown? Is that Jim? Are you there? Oh, Lucille. We have Lucille?
Yes.
Lucille,
yes.
What's your question tonight?
My question is, why can't I find Lysol in the stores? And can I use a steamer cleaner for the floors to clean?
So the question you're asking is how much cleaning do we have to do in the houses that we're currently living in? if we don't have COVID and we're just hanging out at home, your routine way of cleaning your house is perfectly reasonable. There's no data that suggests that the Lysol will help or steaming the floors will help. And in fact, if you don't have COVID and you're in home isolation, just routine cleaning will be more than enough.
Okay. Let's go to Melissa from Brentwood. Melissa, you there?
Yes.
What's your question tonight?
Good evening. My question is, when they open the country back up and we go back to work, what happens with the people who are high risk?
That is a really, really important topic for everyone in medicine right now. I think for those people who are at high risk, before we all go back to work, we're going to see widespread testing to understand for those who have not had overt symptoms and signs of illness, if they in fact had an asymptomatic case and they're covered. So that's going to be the first step. The second and more important step is for those that are at high risk, we're going to think about how to cut down on their risk, part of that community protection, but also for the vaccines that are coming down the pike, those patients who are at high risk will perhaps be among the first populations that will be vaccinated to protect them against COVID. So it's a two-pronged approach. We have to continue to protect them, and we also have to think about those people enrolling in studies to see if we can get a vaccine that will work for them.
Okay. Now there's Debbie from East Moriches. Debbie? Debbie, you there?
Yes, I am.
What's your question tonight?
I have two questions. I'm expecting a granddaughter by a C-section in Southampton Hospital, Stony Brook, Southampton. And my concern is this. I just found out from the registration of the hospital, they're not even going to let my daughter-in-law's, my son, in the hospital. Why is that?
So the answer is we are trying to protect all of the mommies and all of the babies in the hospital. And we are restricting anyone coming in with anybody for anything. If you're admitted to the ICU, if you're admitted to have a baby, or any other reason. We're doing this to protect the moms, protect the other people who are in the hospital, the staff, as well as to protect the baby. We don't know who's an asymptomatic carrier. So that means cutting down on any close exposure to anybody. And we're seeing this in multiple hospitals across New York.
So should we, just to be safe with new babies or any types of toddlers, just keep them away from grandma and granddad regardless?
Well, absolutely. We certainly, like in the flu epidemic, we don't want the grandparents and the little kids hanging out together because unfortunately, far too often, the grandkids are asymptomatic carriers. We don't know, and they're putting their grandparents at high risk. So congratulations on the new baby coming up. You'll have to see the baby on Skype.
Yeah, that's the world we live in right now. All right, let's go to Janet from Franklin Square. Janet, you there?
Yes, I'm here.
Okay, what's your question tonight?
My question is it inevitable that everybody is going to get this virus?
From the current data that we have from Italy and China, we believe that it is inevitable that everyone, if exposed, will get the virus. What you really want to know is that with all the social distancing that we're doing, is it possible that some of our population won't get the virus? And the answer is, I hope so. Because if they get it and they are high risk, they will wind up in the hospital. And that's what we're trying to figure out now. When do we lift all of people being on isolation and letting them come out? And when are we still going to have asymptomatic carriers that could potentially put those people who have been in isolation at risk again? And that's a very difficult decision to do now, and it'll be a difficult decision to do next month as well.
Okay. Let me, as a follow-up to that question, that answer, is there, I know we don't have the answer to my question yet, but is there research being done as to whether different blood types are either more susceptible or less susceptible to the virus?
I think there's research being done on every part of the COVID infection. Is it men more than women, and why is that happening? Is it younger versus older, and why is that happening? Why aren't children getting it? And are the different blood types in any way protective or at higher risk? I can tell you what we're doing at Stony Brook as a clinical trial is asking people who have had COVID to come in and get tested and see if possible we can use some of the plasma, part of their blood, to actually be donated to give to patients who are in the hospital with severe cases for COVID. So I think we'll have more information, and certainly capitalizing on, can we use blood from patients to help others is something we're doing right now.
All right, so let's go to Charlie from Holtzville. Charlie?
Hi, how you doing?
I'm doing great. What's your question?
Okay. Yes, good evening, doctor. My question is, I'm just wondering, because of the way our hospitals are right now, being so overcrowded and packed to the rafters, has any thought been given into looking into some of the buildings in Pilgrim State or the old Kings Park Psychiatric Center, or are those buildings too far gone to be used for something like this, as far as, for beds and stuff goes?
I understand from the governor that they're trying to pick the best locations and the best buildings to be used for expansion as we need it. I suspect that areas like Pilgrim State are too far gone for them to rework, get ready, and use. And it might be, in fact, easier to put something up quickly or use places like the Javits Center, which are up and running with water and heat, as opposed to going to a building that's been shut down for too long. So I think they're trying to pick the best places in the best locations where the population is in order to get a place that's safe for everyone.
Okay, we're going to take a real quick break, but when we come back, we want to hear from you again. The number 516-393-1800. We'll have more from Dr. Sharon Nachman, and we'll be answering your questions live. Stay with us. Welcome back to our coronavirus pandemic special report. Let's bring our doctor, an expert, back in, Dr. Sharon Nachman. She's the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Doctor, before the break we were talking and taking some calls, but let me ask you this. I know that the governor, Dr. Fauci and others have said this is the week, but we're also hearing things like peak and plateau and apex. Can you explain what that means?
Sure. The peak means that we've gotten all the new cases in a rapid fashion to the top of how often they're happening. Think of it as climbing up the mountain. You keep climbing and there's more and more. Now, good news, perhaps we've gotten to the top of the mountain. What we don't know is how big is that top of the mountain? Is it 2 steps and then we're going to walk down the mountain? Or is it a mile wide and it's going to take a long time till we get to this part where we can go down the mountain? What we don't know right now is among those new cases, are we going to see the same rate every day for the week? Are we going to see more new cases like we've been seeing over the past few weeks? Or perhaps over the week, we'll start seeing less new cases and we can begin climbing down the mountain. Because we don't know how big the top of the mountain is, we can't predict how quickly we will start being able to walk down it.
Okay, and this is the deadly week. This is what everyone's saying, that we need to really do our social distancing, right?
Absolutely, and that social distancing isn't going to stop even after this week. If we have good news and we stop seeing the same rate of new infections, that would be great. But a few missteps by everyone saying, oh, we're done, no more social distancing, we could climb right back up that mountain again.
Okay, back to the phone lines. Debbie from Huntington. Debbie, you there?
Yes, I am.
What's your question tonight?
When a person dies of the coronavirus, does the virus immediately die also?
So from what we understand, the virus does not live in the body after the person is gone. The virus needs a certain temperature and a certain humidity. You're not going to be seeing that in someone who is deceased.
And following up on that, if a patient dies from COVID-19, are there organs, if they're an organ donor, are there organs fine to donate?
Unfortunately, the organs are not being able to be used if somebody dies from COVID. I know the Organ Transplant Organization has talked quite a lot about this issue, and at the end they've decided that they will not accept any organs from someone who died of COVID.
Okay, back to the phone lines. I think, is it Bernie? Or?
Yes, that's my name. Do you hear me?
I can hear you just fine. Thanks for calling, and what's your question?
Well, I'm a retired physician, and I feel very, very strongly that there should be no malpractice cases brought forth for anyone who treats COVID-19. What do you think about that?
Well, the governor has heard you, and he has issued a decree that says for those physicians who are taking care of patients in this emergency situation, that there should not be any malpractice unless there's gross negligence. So for people like me that are board certified in pediatrics and pediatric infectious disease. Helping my adult infectious disease colleagues manage adults has allowed us to expand how many physicians we have caring for those patients. So the governor heard you, agrees with you, and has put out the mandate accordingly.
All right, let's go back to the phone line. Linda from Lindenhurst. Linda, you there?
Oh, hi, yes. Thank you for taking my call. I want to ask, say that the grandparents had COVID and say they quarantined for 14 days. Can they visit, say, this weekend with their grandchildren, or do you think it's too soon for the people to be seeing each other?
I think it's probably too soon for you to be seeing each other. We certainly, even though the good news is the grandparents had their COVID and they've gotten them better, we don't want to put the grandchildren at risk, especially if they haven't gotten it. We think about children as being somewhat immune. Somewhat is not 100%. And in the hospital right now at Stony Brook, we do have children with COVID. We are admitting some, and some, in fact, are winding up in the ICU. It is not the same rate as adults, but who wants to put their grandchildren at that risk?
Right. See if we can get another question in. Michael from Mastic. Michael?
Yes, hello. Doctor?
Yep, go ahead.
Yes, I am a veteran that's being treated at East Northport Medical Center for CLL leukemia from Agent Orange exposure when I was in Vietnam. Ironically, I had to take the malaria pill there every day for a couple of years when I was stationed there. Is that something I can ask the doctor for with my advanced COPD to help prevent me from getting to the point where I would have to go to the hospital? Or are we not at that point yet?
Unfortunately, we have absolutely no data that suggests that that medicine, the hydroxychloroquine to prevent malaria, will in any way work to prevent someone from getting COVID. And in fact, as you've heard Dr. Fauci mention multiple times, the data on whether that medication even works for someone who has active COVID is slim and should not be depended on to say that is the appropriate treatment. So we have nothing that shows that will help prevent, and we really don't have very good data that shows it will in fact help to treat. So if you've asked it from your doctor, I suspect they will not be giving it to you.
Doctor, let me ask you this. I know we've been hearing reports that certain hospitals are overrun. I know Huntington Hospital, we've been hearing reports about that being overcrowded at this point. How are you doing at your hospital?
So our hospital is doing quite a good job. The leadership at the hospital have spent many, many hours every day figuring out where else can we put patients, making sure it's safe for them as well as for our staff, and then using those spaces efficiently. We've tried to actually help those patients that need to be discharged home on oxygen, making sure they get their oxygen so they can go home, again, to a safe environment. It's really a team event. Everyone is doing their piece, and everyone is working, I want to say, double overtime to make sure it's safe for the staff as well as the patients.
And right now, do you have plenty of supplies?
We have enough supplies, and we're using them correctly to make sure that we're not putting any of our staff at risk.
Okay, well, Dr. Nachman, we appreciate your time. We appreciate everything you are doing, and if you could just spread that around to your colleagues, that you guys are really the heroes in the front lines. Thank you very much.